Thank you again for coming to this webinar. I am Dr. Mahesh Mulumudi. Many of you know me. For people who don't know me, I'm a cardiologist and I practice in Linwood, Greater Seattle area. I want to talk about blood sugars and its impact on heart health. You might wonder, what is the connection between the blood sugar and heart health? Well, how are they related? And what is the connection? In the last 2 decades, one of the biggest changes that came about for heart health is realizing that diabetes and blood sugar are important. That has more impact on heart artery diseases than other factors. Cholesterol plays a role, but blood sugar plays even important role. And this was identified with treating with a bunch of medications, and all these things showed that the impact of blood sugar on heart disease is profound. Blood sugar, as you know, most of us try to think about blood sugar as a fasting blood sugar. Fasting blood sugar is, if you look at it, is the function of the liver. Fasting blood sugar is when there is no energy supplied from the gut. So what happens is, in a fasting state, the glycogen, the storage form of sugar in the liver, is slowly released into the bloodstream to supply the blood glucose levels by the impact of glucagon. That's one of the hormones. So what happens is, the fasting blood sugar is a measure of liver health and the content of glycogen in the liver. That's how I look at fasting blood sugar. The other kind of blood sugar that we tend to check is the postprandial, meaning after eating. After eating a meal, after about an hour or two, what would the blood pressure would look like? Blood sugar should look like, excuse me. If the blood sugar is high 2 hours later, that also indicates the presence of diabetes. But what is that function coming from? Blood sugar levels after eating is a measure of pancreas health. So what I'm trying to distinguish between the two kinds of blood sugars, the fasting blood sugar and the postprandial, after eating blood sugar, is in a way a good measure of two organ systems, liver on the fasting side and pancreas on the post-eating side. The hormones that regulate the blood sugar, like insulin and glucagon, these are the prime examples of this, are tightly regulated as long as we don't have any metabolic syndrome, or we don't have any diabetes, or we don't have any other conditions that affect these hormones. One of the important ways that we control our metabolism is by regulating these insulin levels and glucagon levels to keep the blood sugar constant. When the blood sugars are elevated, either in the fasting state or after eating, what happens is, the elevated blood sugars get into the cells. The elevated blood sugars that gets into the cells will glycosylate the proteins inside the cells, changes the metabolism inside the cells, and allows them to become targets for blockage formation with plaque buildup. And it's also one of the reasons why we tend to gain weight when blood glucose levels are high in the bloodstream. One of the important things about blood sugar metabolism came from, you may have heard, there is a lizard called Gila monster. Gila monster is about 2 feet long, weighs about 2 to 3 pounds on average, can be up to 5 pounds. Gila monster is native to southwestern United States and Mexico. This large lizard can eat 1.5 times its body weight meal, a meal that weighs 1.5 times its body weight. Still, it maintains a steady glucose level. It also maintains a perfect metabolism. So what is the trick? What is happening here in the Gila monster? The answer came from Gila monster saliva, the venom. The Gila monster saliva has a GLP-1, like the Ozempic almost, GLP-1 compound in the saliva. The identification of that compound in the Gila monster saliva and its ability to maintain the blood sugars led to the development of medications like Ozempic and Wegovy. All these weight loss medications that we see today came from Gila monster venom. It's not the venom that they use today to make these medications. They use synthetic peptides, synthetic proteins to create these drugs, but the original origin of these is from the Gila monster venom. What this GLP-1 does is we also secrete GLP-1. We don't secrete in the saliva. We don't have that much GLP-1 in saliva. We secrete GLP-1 from the cells in the small intestine. Cells in the small intestine release GLP-1 in response to the food that we eat. But the GLP-1 that we release has a short acting time, like 1 to 2 minutes. So we need a constant and continuous supply of GLP-1 to regulate the blood sugars tightly. As we age, one of the changes that come is we lose the ability to create GLP-1s as effectively as we would when we are younger. So how can we make GLP-1 be secreted more in our intestines? How can we keep our metabolism tight and tightly controlled and function as a well-oiled machine? GLP-1 is secreted in response to a few things. For example, chewing the food before we eat has been shown to increase GLP-1. I'm sure we heard this before, that if you chew the food thoroughly before you eat, and if you eat slowly, it's good for you. That good for you has now a molecule to identify with. That is the GLP-1 molecule that is secreted by your intestines. If you chew a bite of food 30 times or more before you swallow, and if you eat small amounts of food, the amount of GLP-1 secreted increases significantly compared to eating food fast. That's an important factor because GLP-1 agonists that control diabetes as medications, we have an internal GLP-1 inside our gut that we can essentially make it go up if we chew slowly. That's one of the reasons why one of the methods to lose weight is to chew food quite a few times, like 30 per bite, and to reduce the amount of food that we eat with each bite. Reducing the size of the bite and chewing it often, like 30 times per bite, will increase GLP-1 and also help to lose weight. By increasing GLP-1, what you're doing is you're actually regulating your blood glucose. Food is nothing but fuel. Food causes the glucose to go up in the bloodstream. If you have GLP-1 to control the blood glucose elevation in the body, then you're keeping your blood glucose levels steady without the glucose peaks. The other factor about chewing is what kind of foods tend to stimulate GLP-1s. All the macronutrients that we eat, meaning protein and fat, tends to increase GLP-1. Look, I didn't say sugars. I didn't say carbohydrates right away. I just said protein and fat. Protein and fat in the diet increases the GLP-1 in the gut. And GLP-1 increase controls the blood sugar. And regulated blood sugars will keep our heart and arteries healthy. That is the link between what we eat and the heart health. And glucose is the molecule between the two. The other factor that, if you look at the proteins and fats that we eat, they stimulate the GLP-1. How about carbohydrates? Carbohydrates have two components, a digestible component, a component that doesn't digest. That doesn't digest is usually the fiber in the carbs that we eat. High carb contents like wheat, rice, potatoes, they all have some amount of fiber. And that fiber content, when it increases in the food, either in the form of vegetables, in the form of legumes, nuts, this undigested fiber gets to the intestines, get fermented, and the fermented fiber becomes what is called small chain fatty acids, meaning small fatty acid compounds that have less number of carbons. That's why it's called small chain fatty acids. And that small chain fatty acids stimulates GLP-1. So again, you know where the story is going, that all the things that we eat, the fiber that we eat that doesn't get digested, gets fermented in the gut, releases the GLP-1 and helps to reduce the blood sugar levels in the body. And the reduced blood sugar levels automatically translates to reduced incidence of heart attack and plaque formation and stroke occurrence. The other factor that I want to bring up is if you take a fruit, fruit has sugar, fruit has fiber. And when you eat a fruit, think about this, the natural way that it combines a fiber that is undigestible gets fermented to release GLP-1 and the sugar that is there to increase our blood sugar. So it has a built-in components to make the sugar go into the body and also to control the amount of sugar in the bloodstream in the form of GLP-1 by our own endogenous, our own gut secreted GLP-1 molecule. So if you think about it, the nature's way of providing sugar and fiber together in a fruit, for example, there is a reason why eating fruits is good for us. Of course, in moderation, primarily for that reason, because the fiber in the fruit will help GLP-1 secretion in the gut. What about the proteins and fats? Proteins and fats are also natural stimulants of the GLP-1 when it comes to carbohydrates, when it comes to complex starches. For example, potatoes. Potatoes in general, we think of it as a high carb diet. It also has some fiber in it. If you cook the potatoes, cool them, and reheat them, you increase the amount of starch that is not digestible, meaning you're increasing the fiber content. You're reducing the blood sugar elevation with that kind of potatoes that are cooked, cooled, and reheated. The same thing applies to rice and pasta also. What I'm saying is, if you want to eat potatoes and keep the blood sugars better controlled, one way to think about it is to make the starch in the potatoes, cook it, cool it, and reheat it, form it as a complex starch. That way, it increases the fiber content. And the fiber content that is not digested goes to intestines, becomes the small chain fatty acids I was describing before, and release the GLP-1 that helps the blood sugar control. So there is a way of eating carbohydrates, complex carbs, like potatoes, rice, and wheat, for example, all these by cooking, cooling, and reheating. I'm not trying to say this is the magic method that makes the potatoes healthy. But if you want to eat potatoes occasionally, you can do this trick to reduce your blood sugar levels. So again, as I said, the fasting blood glucose is a measure of your liver glycogen content and liver function in a way. And your postprandial glucose, the glucose levels after eating, is a measure of your insulin and pancreas. So to keeping the blood sugar tightly controlled within a range, whichever method you use, by medicines, by exercise, by diet, and combination of all these three, has a significant impact on reducing the heart attack and stroke risk. If you look at the blood sugar levels being high after eating, and if they tend to be higher on an average for a person, their risk of heart attack goes 2.8 times than those people that have lower and normal blood sugars. And going back to the blood sugars, what is a normal blood sugar? You want to keep the fasting blood sugar below 80. It's a tough one, especially if you're a diabetic. Below 80 blood sugar is a very tough one. And postprandial blood sugars of 150 or 140 for that matter in 2 hours is also a good number. But diabetics have a tough time keeping that number up there. So the ways of controlling the blood sugar, besides medications, I'll touch on the medications a little bit. I want to focus on diet, exercise, and how do we measure these blood sugars? If I focus on the diet, as I said, chew your food more than 30 times a bite, eat slower, because slower ingestion of food will allow the food to slowly release from the stomach into the intestines, giving the body a chance to absorb and not dump high levels of glucose at one time into the bloodstream. And the kind of food that we eat, protein rich and a fat rich diet, tends to increase our GLP-1s and also is beneficial in reducing the blood glucose levels. And eating fiber in the form of vegetables and fruits and nuts and legumes can also get to the intestines and release GLP-1. And the sequence of eating, for example, if you eat fiber first, so create a layer of fiber, followed by protein and fat combination, and then carb at the end, is a good way of reducing the blood glucose peaks, thereby controlling the atherosclerotic process, so helping the heart health. It reduces the heart attack. If somebody had a heart attack already, it also reduces the subsequent heart attacks that might happen. So there are ways that we eat, meaning chewing the food well, kind of food that we eat, eating enough of fiber to make the GLP-1 to come, eating a high protein and healthy fat diet. They all put together will reduce the amount of glucose peaks that we have our own endogenous GLP-1 compounds that can help us control these blood sugars and have a healthier blood sugar range, hence healthier arteries and healthier heart. If I talk about how do we measure these blood sugars, how do I know if what I'm eating and what I'm doing is the right thing, or is it something that is complex that I should be doing? I want to talk a little bit about the continuous glucose monitors, the CGM. These continuous glucose monitors, they are by two companies that are providing them now. They are both over the counter. One is called the Libre, one is called Stay Low, STELO. Both these things are the size of about a quarter, and the price of these has come down. They are expensive, not inexpensive at least. For a 1 month supply is $85, and you don't have to wear it every month. I would propose saying that wear it for a month, see what your food does to your body, measure your blood glucose, and kind of identify what foods tend to make your blood sugars go high, what foods make your blood sugars stay low or well controlled. You're kind of doing your own experiment. You're kind of seeing how food affects yourself as a personal experiment and kind of identify what you eat and what your blood sugars are doing with it. And this sticker, like a little CGM, it talks to your iPhone app and it continuously measures the blood pressure, blood sugar every 15 minutes and gives a nice graph. And if you happen to be one of my patients, I'm happy to guide you through what these curves and peaks look like and what does it mean to you and what can be done about it. But it's pretty easy to understand. You can, it doesn't matter if you can measure your blood glucose levels using the CGM and identify which foods are making the blood sugar go up, which foods are controlling your blood sugar, and you also understand what your activity level is doing to blood sugars. You'll be in a much healthier state by controlling the blood glucose, eventually affecting the heart health and artery health and carotid arteries. So the impact of the blood glucose on heart arteries and other arteries in the body can be monitored with the help of CGM guided diet and exercise. You heard me say this in the past. I always say that exercise after eating. What you're doing by exercise after eating is, if you exercise after eating, the insulin resistance that we have, the receptors get sensitized with exercise, and insulin can act better. Glucose can enter the cells, reduce the glucose levels. Even if you walk 5 or 10 minutes after eating every meal, it doesn't have to be fancy. You can walk it in your house. It will reduce the blood glucose levels, blood glucose peaks. And those reduced peaks, in turn, translate to heart health. The other important factor that I want to bring up is when you see your cholesterol levels, if the triglyceride levels are high, it's a good indicator of insulin resistance. As a matter of fact, it's a good indicator of how well your blood glucose is staying low or staying high, or is it staying in a kind of a peaks, constant peaks. Constant peaks will tend to cause triglycerides to go up. If your triglycerides are up, one of the reasons is there are familial forms. There are somebody people are born with it, but most of the time triglyceride elevation is because of insulin resistance, because of poor glucose control, or their peaks are too high. The glucose peaks are high. They need to be suppressed. So the way I'm proposing to use the CGM, the continuous glucose monitor, use it to monitor your glucose levels, see how it is influenced by the foods that you eat, see how it influences the food that the way you cook, for example, or the way you eat, the kind of foods that you eat. All these can be measured with the CGM. And the activity level also can be measured with CGM. Suppose if your peaks are happening an hour after eating, for example, and keep your walking plan an hour after eating or immediately after eating. So you can time the exercise, you can measure the kind of food that helps you and the kind of food that doesn't help your blood sugars. So the impact of blood sugars on atherosclerosis is on plaque formation is an interesting process. Heart is a very metabolically active organ, meaning it consumes plenty energy. The beating heart requires a lot of energy. When we have insulin resistance, when the glucose levels are high, when the glucose intake into the cells is not doing well, what will happen is the cells transform in a way that they cannot metabolize properly, and they take up fatty acids like fats and then form plaque. That is the link between the glucose and plaque formation. So hopefully you see the connection between high glucose will lead to high glucose oxidation in the cells, leading to high fat accumulation in the cells, forming atherosclerotic plaque or heart artery blockages. So controlling the blood sugars and reducing the glucose peaks with eating is a few ways that we can have good glucose levels to maintain heart health and prevent any blockage formation or reduce the incidence of heart attack and stroke. So what I try to explain with all this is keep a tight leash on the blood sugars. Fasting blood sugar being controlled is important, but the postprandial, meaning blood sugars after eating and being high, is a problem. That itself is associated with higher heart attacks and higher stroke risk. So your ability to control and maintain the glucose by eating properly, by chewing properly, eating the right kinds of food, eating complex starch. I just gave a trick about these potatoes being cooked, cooled, and reheated concept to make the starch in the potatoes to become complex fiber, increase the fiber content, make it an indigestible starch. And that starch goes to the gut, fermented, and releases the GLP-1. So in a way, we are trying to become a GLP-1 producing organ in the body. We have it. We're trying to increase the GLP-1 production. It's like taking Ozempic-like medications without taking Ozempic-like medications. We are creating the GLP-1 within our cells by eating properly, by exercising properly, and chewing our food. In a way, we are becoming the Gila monster that has natural GLP-1 in the saliva. We don't have it in the saliva, but we have it in our gut. We can enhance the production. So these are a few ways that I want to focus today and talk about how glucose can be controlled by different methods, non-pharmacologic, non-medication methods. There are medication methods, of course. We can take insulin for diabetes, and that may or may not be the right thing for a particular patient. And the other one, the other compound that people tend to take is, for example, Jardiance is called the SGLT2 inhibitor. These Jardiance like compounds, what they do is they allow somebody to excrete glucose in the urine. They pee glucose out, thereby controlling the glucose levels. These SGLT2 compounds, sometimes you see me or see other physicians prescribing these SGLT2 compounds for people with heart disease because it's been shown that these SGLT2 inhibitor compounds also reduce the chance of heart attack and stroke, not just by controlling the blood glucose alone. This molecule has beneficial effect on changing the metabolism of the heart cells and also changing the metabolism of kidney cells. You'll be surprised to hear how kidney and heart are connected. If you control the blood glucose, if you reduce the atherosclerosis or heart artery or any artery disease, you also are controlling the kidney function. Kidney function also gets better. As a matter of fact, these GLP-1 antagonists like the Ozempics, they are also shown that kidney function is preserved in patients taking these compounds. You know where this is all going? Both the heart function, the heart health, and the kidney health, they're all connected with one molecule, the glucose. If we control the glucose by different methods we talked about today, we can definitely control heart health and kidney health. Heart and kidney are one of the most metabolically active organs in the body. Brain is the other one. And you'll be surprised to know that the Alzheimer's disease has slowed down with the use of GLP-1s. Like, for example, Ozempic has been shown to impact Alzheimer's also. It's not about the question of Ozempic, it's a question of GLP. Suppose if we increase the GLP in our bodies, we are essentially controlling heart artery health, kidney health, and brain health. And one molecule that is an indicator of all the GLP-1 status in the body and how well is our glucose controlled is blood glucose, and that can be measured with CGMs. And I'm a big proponent of CGM for one important reason, because it's simpler to measure. It's you just wear it and measure it continuously. You don't have to wear it month after month. Wear it for about a month. Get a feel for what your diet and your lifestyle is doing to your blood glucose, and you can change it. And you know which, by changing what, is causing what impact on the blood glucose levels. So I'm definitely here to help. If anybody that likes to have a CGM or and work with a CGM or look at the curves, happy to guide you through all these things. Again, we are at the 30-minute mark almost. So I'm going to recap quickly. Blood glucose is one molecule that affects the health of multiple organs, importantly, the heart, the kidney, and the brain. And for the heart health and the artery health, blood glucose levels can tightly be controlled with our endogenous, our own secreted GLP-1, which comes from the intestines. The way we eat, by chewing, the kind of food that we eat, fibers that we eat, and even the starch that we eat, that is complex starches, like cooked, cooled, and heated potato, for example, they all will help us in making us healthier, heart way, kidney way, and the brain way. And if you think about this, GLP-1 we tend to lose with age. What we're doing is enhancing the release of GLP-1 by doing all these different things. We can make an impact on our heart health. Thank you very much for all of your time. And I'm here to answer any questions you may have.